Module 2, Getting Ready to Understand and Fight COVID-19. In this module, we will learn how COVID spreads, what we need to avoid, and how to take care. We will also understand various symptoms of COVID-19 and how to differentiate with normal viral fever, distancing, and quarantine. We will then understand why avoiding public places and lockdown becomes necessary to stop the spread of COVID-19. How does coronavirus spread? COVID-19 spreads mainly by droplets produced as a result of coughing or sneezing from a COVID-19 infected person. This can happen in two ways. First one, direct close contact. One can get the infection by being in close contact with COVID-19 patients, that is within 1 meter of the infected person, especially if they do not cover their face when coughing or sneezing. Second one, indirect contact. The droplets from the COVID-19 infected patient survive on surfaces and clothes for many days. Therefore, touching any such infected surface or cloth and then touching one's mouth, nose, or eyes can transmit the disease. Now let us look at a short video to understand how the COVID-19 spreads faster and to other people. Symptoms of coronavirus. First one, you will observe signs of infection, including fever with above 100.4 degree Fahrenheit temperature, cough, shortness of breath, and breathing difficulties. Other signs include loss of taste or smell as well as muscle aches. Some less common symptoms include conjunctivitis, headache, a rash on skin, or discoloration of fingers or toes. In more severe cases, it can lead to pneumonia, multiple organ failure, and even death. What is the time period if we have COVID-19 and how soon will we get to know? The time between infection and the onset of symptoms range from 1 to 14 days. Most infected people show symptoms within 5 to 6 days. However, Infected patients can also be asymptomatic, meaning they do not display any symptoms despite having the virus in their systems. There is no proof yet that asymptomatic patients can spread the virus further. Now let us look at a short video which explains the symptoms caused due to the virus. Asymptomatic COVID. You can have coronavirus even without you knowing or with very mild symptoms. That's why maintaining distance with others is very important. Do not spit here and there and use handkerchief while coughing or sneezing. Avoid going into public places and coming into contact with people who have come from different places. What is the difference between self-isolation, self-quarantine and distancing? Quarantine means restricting activities or separating people who are not ill themselves but may have been exposed to COVID-19. The goal is to prevent spread of the disease at the time when people just develop symptoms. Therefore, if you have been exposed to someone with COVID-19, you should self-quarantine for the entire 14 days. Even if you feel fine, you are still at risk of spreading the coronavirus to others. Isolation. Isolation means separating people who are ill with symptoms of COVID-19 and may be infectious to prevent the spread of the disease. The time period for isolation is 7 days and the time period for quarantine is 14 days. Physical distancing. Physical distancing means being physically apart. The World Health Organization recommends keeping at least 2 meters distance from others. This is a general measure that everyone should take even if they are well with no known exposure to COVID-19. Physical distancing is very important at ATMs, banks, grocery stores, and even workplaces. Why are social distancing and lockdown important? If you can look at the picture, without social distancing, if we have one case, after 1 week there would be 3 more cases, but after 6 weeks we would have more than 1,000 cases. But if we follow social distancing, now if we have one case, after 1 week we would have 2 more cases, and after 6 weeks we would have just cases below 150. That is why social distancing is called the first line of defense against COVID-19. Thank you for listening to this module. In the next module, we will look at the actions to prevent COVID-19.